In this video, we will learn about all the medical facts about Alzheimer's disease and how does it affect the brain. The disease today known as Alzheimer's, which is the seventh greatest cause of death in the United States, was initially characterized as a peculiar disease by German physician Doctor Alois Alzheimer in 1906. It is characterized by severe memory loss and microscopic alterations in the brain. There are 5 crucial details about Alzheimer's illness. The first truth is that Alzheimer's disease accounts for 60 to 80% of dementia cases and is the most frequent cause of dementia. Memory loss and other cognitive impairments severe enough to interfere with daily life are collectively referred to as dementia. The second fact is that Alzheimer's is not a normal part of aging. However, the greatest known risk factor is increasing age, and the majority of people with Alzheimer's disease are 65 years and older. The third reality is that Alzheimer's disease progresses over years, with symptoms of dementia gradually getting worse. The fourth reality is that there is no known treatment for Alzheimer's disease. Instead, efforts are made to reduce symptoms of dementia and enhance quality of life. The fifth fact is that memory loss has many diverse origins and is not just brought on by Alzheimer's disease. What signs and symptoms are there for Alzheimer's disease? Typically, the learning-related area of the brain is where Alzheimer's alterations first manifest. Alzheimer's disease causes increasingly severe symptoms as it spreads through the brain, such as confusion, mood and behavior changes, a worsening sense of time and location, and irrational suspicions of close friends, family, and professional caregivers. Alzheimer's disease that is more advanced causes more severe memory loss, behavioral changes, speech, swallowing, and mobility difficulties. How does Alzheimer's disease affect the brain? Long before memory loss symptoms appear, the brain begins to change on a microscopic level. The brain contains billions of neurons, or nerve cells. Each nerve cell forms a network of connections with many other cells. Nerve cell clusters perform specific functions. Some are engaged in cognitive processes, including learning and memory. Others aid in our ability to see, hear, and smell. Brain cells work like little factories to complete their tasks. They get supplies, produce energy, build machinery, and remove waste. Additionally, cells process, store, and exchange information with one another. Coordination is needed to keep everything functioning, along with a lot of fuel and oxygen. According to researchers, Alzheimer's disease hinders certain processes in the cell factory. As the damage grows, the cells become less functional and eventually die, leaving the brain permanently altered. Plaques and tangles, 2 aberrant formations, are thought to be the main culprits in the harm and death of nerve cells. Plaques are deposits of a protein fragment called beta amyloid that build up in the spaces between nerve cells. Tangles are twisted fibers of another protein called tau that build up inside nerve cells. Although studies suggest that most people have some plaque and tangle development as they age, those who have Alzheimer's tend to experience far more development and in a regular manner, starting in the memory-related areas before spreading to other areas. Plaques and tangles are crucial in preventing communication between nerve cells and interfering with activities that are necessary for cell survival. Memory loss, personality changes, difficulty performing daily tasks, and other symptoms of Alzheimer's disease are brought on by the death and destruction of nerve cells. What phases of Alzheimer's are there? There are 3 phases of Alzheimer's: a mild stage, a moderate stage, and a severe stage. People who are in the mild stage have a worse memory loss and other cognitive issues, wandering, having problems handling money and paying bills, asking the same questions repeatedly, taking longer to do ordinary daily tasks, and personality and behavioral changes can all be issued. On moderate stage, damage occurs in areas of the brain that control language, reasoning, conscious thought, and sensory processing, such as the ability to correctly detect sounds and smells. As disorientation and memory loss worsen, it gets harder for people to identify their loved ones. Additionally, those who are in this stage may have paranoia, delusions, and hallucinations. Eventually, at the severe stage, plaques and tangles cover the entire brain, and the amount of brain tissue reduces noticeably. People in this stage are unable to communicate and are totally reliant on others to take care of them. Near the end of life, the person may be in bed most or all of the time, as the body shuts down. How is Alzheimer's illness handled medically? Treatment that is started as early in the disease as possible may assist maintain daily functioning for a time. A timely diagnosis aids families in making future plans. Although there is presently no treatment for Alzheimer's, new drugs are being developed to slow the disease's progression. Additionally, there are drugs that may assist some people temporarily improve or stabilize their memory and cognitive abilities, as well as manage some symptoms and behavioral issues. What about Alzheimer's disease complications? Restlessness, anxiety, bladder and bowel issues, sleeping issues, mood swings, falls, infections, malnutrition, and dehydration are some of the complications of Alzheimer's disease. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.